Okay, everybody, Dr. Amy here. So I wanted to do a quick video about what we do from a focus approach and perspective when we have kids that it's not super easy or comfortable for them to get adjusted. First, I think everybody had great suggestions. I think there's a ton of really great things from, checking a teddy bear, really good because you're improving prediction, because you're showing them from start to finish what this looks like. You're giving them some control and some ability to predict what's going to happen, to checking them where they are, not forcing anything on them, checking them in the toy area, letting them kind of guide that interaction. Storyboarding. I love it in the non-screen version even better, but I get that sometimes that's necessary. But where we're giving them imagery, we're giving them like a picture to guide what the next step is. First I come in and I go potty, here's the picture of that. Then I come in and I go into the adjusting room. Then I lay on the table. Great things. Those of you who've taken focus seminars in any level or any capacity know why that is. Because the thing is, and what I'm so passionate about, is giving you guys tons of information and really practical things to do in regards to working with anybody in chronic stress, but behavioral learning, socialization, developmental challenges specifically, or traumatic brain injuries. But really not just that, understanding why. And from a practical standpoint, a clinical standpoint, like why do you see the aberrant eye movements? Why do you see the primitive reflexes? Why? Not just what do we do, but why? I want to teach you how to think. That allows us to have way better results, way better retention, way better co-management, and really step into the real conversation about how to help these kids in a real professional way outside of chiropractic, even with other professionals. So a couple things that I want to give you, actually two things just today, and we'll do lots more on this, but one of the things I want to teach you is, those of you who've taken level 1, you understand that, the brain develops in a certain way. So we know that bottom up, back to front, inside out, right to left. We get that there are tools or clues, tools that we have to process our world that become more sophisticated as we move through that development, starting with primitive reflexes, then movement touch, auditory verbal, and then visual cognitive skills, which come from eye movements. And so if we're not there yet, which most of these individuals are not there yet in development, then we need to understand where they are. So one of the ways, there's a whole lot of ways we understand where they are from our clinical perspective. In our exam we teach, but one of the ways is to just look at what they're doing. So if you have a child who is talking a lot and their deflection, they get stressed, they get an anxiety, and they're like hyperverbal, they're scripting. It might not be expressive language, like really sophisticated language, but they're making a lot of noises. They're maybe ticking with their mouth, with noises, they're humming. You notice as stress goes up, anxiety goes up, they're getting nervous, their world is complex, and they start to make more noises in an auditory verbal way. Here's what you don't want to do. For that individual, you don't want to try to dominate their auditory world. You don't want to give them a lot of verbal instructions. In that individual, this isn't going to be the same for all individuals, but when you understand that that behavior is a window to the brain that gives you so much information, in that individual, you want to stop. You want to let them control their auditory world. They are looking for control and prediction, and one of their primary tools is auditory because they're not there yet in full brain development or function. So you need to drop down and let them control that. You need to use fewer words. You need to drop your body down, decrease visual cognitive demand by letting them engage in convergence or the usage of their eyes in a downward gaze. And you need to gesture. Maybe a few words. Shorter sentences, lower tone, make it not as fast, like lengthen your words, slow them down, not like you're speaking to them like they're not intelligent. That's not it. You're just lowering your demand in an auditory verbal way because they are working to control, deflecting to control their auditory verbal world, which tells you they need to do that, and you need to drop down. So fewer words, gesture, pat to them where you want them on the table, not in a condescending way, in a way that's meeting them where they are and letting them have some control and prediction. one example of one individual. There's no one size fits all. If you see that behavior, it's a window to the brain. That's what you do in that scenario. Play with that. The other thing is face down on a table with an individual who's either in chronic stress or is not there yet in development. Face down decreases their ability to visualize what's happening back here because they literally have taken that out. This is a rather stressful scenario. Now you increase their stress by putting your hands in a very sensitive area that they cannot predict, control, or see. So face down can be really stressful. You may not want to start there. You may want to start seated. You may want to start laying on mom where they can still see mom, but you're in front of them. Definitely give them some prediction by showing it on somebody else. Know that you're going to have to work into this. And when they start to be able to lay face down, that could be a huge window into a developing brain and a growing brain that they're starting to be able to engage and visualize outside of self in their mind's eye. That's a win. So a little bit of understanding and a little bit of a specific action step. I'll do tons on this if you guys are interested. We have to know more, not necessarily do more.